Good afternoon, everyone, and welcome. The former presidency has challenged and altered our society and protocol of our government, in addition to the racial tension exacerbated by the COVID-19 pandemic. In short, the COVID-19 pandemic has created or exacerbated inequality that had already existed in education and in American society. Disadvantaged families are experiencing more hardship and lack of access to learning materials, educational resources, and technology, all of which hinder their access to remote learning. Some children do not have adults or older siblings that can help them. Our students have also been impacted by the disruption in routines and the relationships that they relied on through and in schools. Friends and peers are no longer available to work in groups in the normal sense. Educators have had to revamp cooperative learning groups in Zoom or other digital platforms as much as possible with extreme challenges. For a very long time, schools have served as a mental health system for many children and adolescents. About 57% of mental health services are provided to children via the school system. We may never understand the pandemic's long-term mental health effects on children. How can we promote healthy development in the midst of a global crisis? How can we assist families in developing resiliency? How can we help students feel socially connected? How can schools provide a space for children to express their feelings? We must utilize and implement every strategy so that our students emerge healthy, happy, and whole. With the inconsistency in school reopening plans across the country and the threats of government officials to retain funding if schools do not reopen, what has been your school district's response? And have we opened Pandora's box in reopening schools? We are so very thankful and I appreciate our illustrious panel that we have today. We have Ms. Jessica Sawyer Horn, who is an experienced LCSW social worker. She has worked in multiple settings, including the VA hospital, school settings, and also in private businesses. We also have Dr. Kathleen Setzer, who is a principal in Baltimore City Schools, Dr. Carolyn Anderson, who is an administrator and an educator in Aiken Public Schools. So I'm going to begin with Dr. Setzer and Dr. Carolyn Anderson. Since the pandemic, how has your leadership style changed? And not only your leadership style within your district.
Good afternoon, everyone. Thank you for the invitation. My leadership style shifted to more of nurturing my staff throughout the pandemic. The district implemented quite a few changes very quickly, and staff had to pivot in order to accommodate district goals and meet students' needs. So I found myself making sure that my staff were okay and had the tools that they need to be successful in implementing the plans for our students. So my style shifted to more collaborative, to more of nurturing my staff and making sure that they were okay emotionally during this time.
Thank you so much.
Good morning. I wanted to make a clarification. This year, I'm not currently working in the role of an administrator, but I do work in the role as a professional growth coach with teachers. And I agree with the last speaker's statement that this year, teachers have needed more support than ever. We talk a lot about the socio-emotional needs of the learner, the student, but those teachers have those same needs. And it was so much coming at them at once in regards to changing on a dime with instructional practices and learning several platforms at once that many were overwhelmed. along with being fearful for their lives during the pandemic. So providing a lot of nurturing and a lot of socio-emotional support for teachers is the role that I have served in this year.
Thank you, Dr. Anderson and Dr. Setzer. Now we're going to move on to procedures and protocol. How do you handle visitors to your school? And has your district implemented an equity audit for your curriculum for subs, non-experienced teachers working virtually or face-to-face, for your gifted, special ed, and other special programs? Dr. Setzer. Or Dr. Anderson?
I apologize, I'm on mute. So we did an equity audit at the school-based level. I work at a technical high school. So what the district provided in curriculum did not meet the needs of my learners. So my teachers picked up a lot of that load and lifted and made sure that they implemented culturally relevant pedagogy in the virtual environment to meet all of our students' needs.
Dr. Anderson?
What our district implemented was a no visitation policy. So parents, even when they bring their children to school, they cannot enter into the building. The students have to ring in, they're screened at the door. Then we have sanitization stations at the front of the school before they can even enter. So we have a zero visitation policy at our school. Subs, they work for an agency as a subcontractor. And we have seen that the number of subs that we have available has decreased due to the pandemic. Many parents were upset that they are not allowed into the building, but it's for safety precautions. Also, the performances and other activities that we usually had that parents came to have been eliminated for the school term.
Thank you, Dr. Anderson. We also want to welcome Mr. Lionel Martin. Mr. Lionel Martin is a veteran educator for over 30 years. He has served in the World Language Department and also in the Science Department. He has been an administrator in Horry County Schools, and he's currently in the Charleston Catholic Diocese. Welcome, Mr. Martin. Okay, now our next. Now we're going to discuss how has your district spent federal COVID-19 funds, and how do you handle recess for younger students? Dr. Setzer, then Dr. Anderson.
So I'm at the high school level, so we really don't deal with recess at that level at the technical school. What we've done with our federal COVID CARES Act funding is provided tutoring for students who are struggling. We noticed when we looked at grades from first quarter to second quarter that we had a very high failure rate. So we immediately implemented after school and our asynchronous learning time tutoring for our students to meet their needs. And what we discovered is with that small base tutoring, that students in grades increased over the second quarter. So that's what we did to kind of use those CARES Act funding. We also bought PPE when we were thinking about coming back to in-person learning. So we made sure we had a heavy supply of PPE to facilitate and mitigate when we decided to move into in-person learning in our district.
Thank you, Dr. Setzer. Dr. Anderson?
Our school is currently back in session 5 days a week. Funds were used to buy PPE, screens for each desk for students, sanitation stations for each classroom, masks, shields, also water stations in the hallway. We also implemented after-school programs for additional support for students who would like. It was not just limited to students who were not passing, but any student that wanted to participate had the opportunity to attend these after-school sessions. We're also preparing for summer school for additional support for students as well. We have two different options. We started school year with, you could go to school on a hybrid schedule, which was students were assigned to cohorts A and B. Cohort A, which cohort A came to school on Tuesdays and Thursdays. Cohort B attended school on Mondays and Wednesdays, and school had a virtual option on Friday. However, beginning of February, we transitioned back to 5 days a week for students who were on the cohort schedule, and students who attended school virtually had the option to return to school at that time. Now we still have some students who are online, but we attend 5 days a week.
Thank you, Dr. Anderson. Dr. Setzer and Dr. Anderson, how do you handle activities with testing and your other programs within the school?
Okay, so we are a technical school, so we do a lot of hands-on work with our students. So students learn skills in nursing, culinary, baking, computer networking, automotive, diesel, and building construction trades. So when we looked at meeting the students' needs, we had to make sure that we had very tight mitigation procedures in place so that students could work with one another. What happened is our teachers would time activities. So when students had to do hands-on activities, they would work in probably 11 to 14 minutes chunk time together to make sure that we were following the CDC protocols. We also had all students with face shields and masking during the school day. We also provided, sanitizer and wipes so that they wipe down equipment before use and after use to prepare, to make sure that we followed those protocols. So a lot of the things that we did was ensuring that students could still have those hands-on experiences, which are critical in a technical school for certification, while still maintaining the CDC protocol to keep them safe.
Now, when this pandemic started, we did not have a handbook of what to do and what not to do. Dr. Setzer and Dr. Anderson, if you could do things differently, and could you tell us what would you change and what has worked and what has not worked?
So for us, the one thing I would change is we pull students from 10 different schools, so that doesn't make the cohorting model very efficient for us. In fact, it doesn't even exist. I would have used a different process for grouping our students to ensure that we could keep a somewhat cohorted model by school versus by zip code to kind of mitigate, that cross-contamination that could possibly occur. Things that worked very well for us were actually the students and staff were excited to be back in the building. We made sure that all of our staff were vaccinated before students returned, so that reduced their anxiety. Since we have been in the building, we're only in the building 2 days a week for our cohorts. We've noticed that students have better engagement. Students, we noticed that their social and emotional health is starting to shift, and they're starting to open up and trust teachers more. So we've noticed the benefit for our students being in person, which was very important. And also students now that they are in person are reaching the goals of meeting their certification requirements. So it has been very exciting for us having everybody in the building.
Dr. Anderson?
Let me piggyback. You talked about recess and breaks. I work with at a junior high type school, 7th and 8th grade, and also at a 6th grade building. students do not have recess. They do not have breaks. But I know there's an elementary school that is situated on right on the campus with the intermediate school. I noticed that the elementary school students at recess are allowed to take their mask off. They do have mask breaks there during recess. However, in my district, we are seeing a rise of COVID-19 in our population. And what I'm seeing now, that with school students being at school 5 days a week, they have become too social in the hallways, high-fiving, dapping. When we came back 5 days, it's as if their minds say went to 5 days and everything's back to normal. And just policing that has been difficult because they want to dap each other up, touch each other, socialize. We've been more of the social police. And I also, because some of these, because the cohorts were separated, there are students in their class that they never saw prior to being back 5 days. And especially with the change of the weather, and we know how students can get during springtime anyhow. It's been a policing situation. Pull up your mask over your nose. Do not touch each other. Remember, we're still in a pandemic. We're working together to stay safe. Let's work together to keep everyone safe. That type of situation is transpiring now, and we are seeing our COVID numbers increase again.
Tell me, Dr. Stetzer and Dr. Anderson, how have you handled staff health restrictions? And does your district have deep cleaning days for the schools? And have you hired more custodians?
So our district does have protocols in place for staff. We have been very fortunate in our school that we have not had staff excluded due to COVID-like illness. What we did was we hired 2 substitutes long-term in our building just to make sure we had coverage in case a teacher had to be absent due to illness or family illness. Our custodial staff remained the same. What happened during COVID is they staggered the staff so that they would work on 1 week and off 1 week. So they staggered their schedules. We do have deep cleaning in our building. Our deep cleaning days are on Wednesdays and in the evening once students and staff leave the building. So now we have a set time where student staff must exit so that those things can take place.
Dr. Anderson?
Our district has safety protocols in place. Custodians deep clean the school daily. And all teachers are required to sanitize rooms between class changes. And all students are required to sanitize on their way into the classroom and as they exit the classroom.
Thank you, Dr. Anderson. Now we're going to talk and focus more on students and families and the social emotional impact on students since COVID-19. Ms. Jessica Sawyer Horn is a licensed clinical social worker. Mrs. Horn?
Hello, how are you doing, everyone? Hold on just a minute. In North Carolina, and since the pandemic started, our county was like number 1, between 1 and 3. It bounced between 1 and 3 in the state. So we remain virtually or remote since March. And in August, our staff came back to the building and the students remained remote. And then March I think the 8th, I believe, students were able to come back on the cohort days, 2 days for group A, Monday, Tuesday, two days for group B, Thursday, Friday, Wednesday was the deep cleaning day. And like some of the other administrators had mentioned, the custodial staff have been there every day to clean, but Wednesday was the designated remote learning day and deep cleaning day. And in North Carolina, I just wanted to point out, I had did this slide presentation. Our educational system worldwide has been shut down since March 2020, not just in the United States, but worldwide. The enrollment has went down, and enrollment, as you know, is tied to funding. It has altered 1.5 million public school students' learning since the spring absences, truancy, to so to speak, grades, and everything else. If you go to the next slide. Okay, keep going. So the issues are impact on teachers, because what we have to do, go back, in social emotional learning, North Carolina Department of Public Instruction, we've traditionally known in the school system that social emotional learning was school counselors focused on the students, but we also have to address adult social emotional learning. In the state of North Carolina, I wanted to point out 27,000 education jobs have been open since the pandemic. A lot of teachers retired, and supply and demand has been an issue. Who are we going to get to teach these students? We have in our district a contractual agency that hires subs for buses, custodial, and teachers. But like we're saying, people were scared of the pandemic. Safety concerns. What I've seen as a school-based mental health counselor, a lot of frustration, lack of student motivation, not getting online. I had to get out with my other colleagues, the attendance coordinators, school social worker, mental health counselors, and myself. We had to do a lot of home visits and per CDC guidelines. And what that basically meant is I stayed in my car. I would either call or beep the horn, or I would get out and knock on the door with the gloves on and have them come out with my mask and tell them to remain social distance, to check on students that we had a hard time reaching. Why are you not getting online? And looking at the barriers, a lot of educational, academic, and social emotional barriers. If you could go on to the next one. Keep going. A lot of grief and loss for everybody, administrators, staff, students. When the pandemic first happened, we lost one of our school resource officers. He was the first one in the district, staff-wise, to die. And we've had several staff die from COVID in our school district. Family members, we've had children that family members' parents have died from COVID-19 and other, deaths. But one of the things I want to point out is that administrators in the district, school counselors, who's ever doing the programming, needs to pinpoint on programs surrounding grief, loss, and traumatic events. One thing I want to point out is that anticipatory grief, now that we have been kind of acute stress or traumatized in a way because of how the pandemic, we watched it unfold globally and in our own local, state, federal areas. You have complex trauma, complex grief, and anticipatory means that I know somebody's sick, or if I hear somebody get sick with COVID, I'm kind of anticipating the worst outcome. So these are things that we need to be aware of and educated about in our counseling programs in the school systems. Can you go next? Okay, keep going. All right, next. One of the things I want to point out is adverse childhood experiences. Not only do we have the traumatic experience of COVID, but these students, as you all know, in the school system have already been having problems. Our district has trained the whole school district on adverse child experiences, and you can get training in your district, and it basically focuses on questions to screen if students have been exposed to violence, abuse, neglect. Have they had any family members die by suicide, or anybody in the home, in prison, incarcerated, drugs, alcohol? So not only are we dealing with COVID, but we're also dealing with these other psychosocial stressors that children and families or parents are exposed to. Okay, next slide. One of the things I wanted to focus on is Maslow's hierarchy of needs. During this pandemic, and I'll just use myself as an example, in the United States of America, you know, we're the land of the free, the home of the brave, and we're used to being able to get our needs met. You know, it was no problem to go to the store, get online or whatever, and get your basic needs, food, clothing, shelter. But when the pandemic occurred, we were not prepared for that. And so I had to deal with, when we were allowed to go, you know, when we were on lockdown, so to speak, or state of emergency, even when you went to the store, there was no toilet paper. No toilet paper, no hand sanitizer. Even now it's hard to get Lysol spray. So we have to focus on making sure the basic needs are met, and, you know, trying to normalize things to students and staff, that, okay, you might not have these things that we're used to that make us comfortable, but do you have a place to live? Are you homeless? So we need to address those issues. Next slide, please. This is what I wanted to briefly touch: strategies, interventions, and resources. Make sure that in your districts, you are definitely using student support services. In North Carolina, the Department of Public Instruction has developed a Lighting Our Way Forward, and it has plans already that the state has laid out for districts to follow: Plan A, Plan B, Plan C. Plan C is remote. Plan B is the cohort. Plan A is 5 days a week. Making sure you have staff, administrative support, student, parent support. Next slide, please. Restorative practices. That's one of the things we've been doing in our district. It has that book, Circle Forward, Building a Restorative School. Social circles. We have been conducting, before COVID, our district had training in social circles, and they were, especially in the middle schools, we have what you call tag, and that's like during the first block, the first 30 minutes, and it's basically like a group, and it has a book with different topics of like how to deal with your feelings and different things. And we've been doing that in our district the past couple of years. But me and my colleagues who were other mental health counselors, we did social circles with staff to assess their feelings with students returning to school and how they've been feeling since the return, and just working with them in that area. Making sure your classrooms are trauma informed, being sensitive, the multi-tiered system support. We do a lot of suicide threat screenings using the Columbia Suicide Severity Rating Scale. Crisis response teams. Some districts have on their website, if you go to the counseling or social work department on the website, a virtual calming room. And what that basically is, it has a lot of, you can have like mental health apps that you can download on your phone, like Calm and teaching mindfulness. And the virtual calming room, your counselors and mental health counselors can put on a school district website, different places that staff and students can go and have activities on there for them. Next slide, please. Next slide. And making sure you have grief support groups and different things. Another thing is that important on tiers, multi-tier system support, check in, check out, you probably heard of. Checking in and making sure your students, that's like a part of mindfulness when you're dealing with traumatic events. Bringing them here in the here and now. Today, I'm looking forward to this. This morning, I feel in the blue zone. I feel in the green zone, and you can see the different feelings. Getting them to connect with the feelings and letting them know that it's okay to share their feelings. What are you worried about today? What is your goal? And the teachers have to make sure that their approach to building positive student, teacher, student, parent interactions are on another level. Next slide, please. Okay, keep going. Resources, I don't know if within the other states, South Carolina, Maryland, or who other states, but in North Carolina, you can go to the Department of Public Instruction's web page. I put a link there. They have a whole slew of information for parents and caretakers, how to deal with their children with remote learning, because parents had to become like teacher-like mode. You know, they had to learn how to help the students learn with the online learning with the teachers. It has a lot of COVID resources, educational resources that parents can share. In our district, we I think some of the CARES Act or funding they use to get hotspots, because we live in a rural area, and some locations they could not get internet service. So we went and distributed. I myself would do home visits to help distribute the hotspots. Next slide, please. These are resources primarily in North Carolina, and it lists for adult staff social emotional needs. North Carolina is very good about free resources like the Hope for North Carolina helpline, Hope for Healers Optimus, a 24-hour 1-800 number, confidential. So in your school district, make sure that staff are aware of EAP, employee assistance programs and resources, and just having that resource there. If they don't want to talk to you or let you know what's going on, they know where to access these resources. Some districts a lot of people do a lot of Google Classroom, Google folders. You can upload a lot of adult social emotional learning too. Next slide. I think that's it. Just making sure that your staff, and I think Dr. Silser had mentioned that, just making that sure that your staff like consider reducing their workload, changing how they're teaching their class, mental hygiene, recognizing their own grief and loss and how COVID affect them, and then joining with students and saying, this is how it was for me with COVID. I think the first couple of weeks your students get back in the classroom, that should be definitely discussed, and how their experience was from then to now, and asking for help and creating physical space. Like in our class, we have tape down and the 6 feet and shields around the desk, and whatever makes people feel comfortable. Next slide, please. I think this is it.
Dr. Setzer and Dr. Anderson, can you please tell us, how has the pandemic impacted staff morale?
Who was that question directed to?
Dr. Setzer and Dr. Anderson, how has the pandemic impacted staff morale, student morale, and parent morale?
Okay, thank you. So our staff, when we were in virtual learning, felt very disconnected from students. And so what we would do would be recognizing the good things they did in the classroom with virtual certificates of appreciation. We did a teacher of the month, we did students of the month, and we actually mailed out gift cards and medals to recognize the good things they were doing in the classroom. I did a lot of grace with observations, because teachers were learning new tools. So we shifted how we observed teachers and set standards that were reasonable, such as student participation at 50%, because we found that students were not engaged in virtual learning. When we returned into the building, we started celebrating monthly. So for example, on St. Patrick's Day, when teachers returned to the building, we did a candy bar that was in a green theme and welcomed them back and told them that we were lucky to have them in the building. When we had opening day for our baseball team, we walked around little opening day snack packs to teachers to make them feel appreciated. So it's a lot of ensuring that our teachers felt appreciated and felt valued that increased their morale, and celebrating the small student successes increased student morale. Most of our parents were excited once students entered into the building, so they were very grateful that students had the opportunity. While we only have about 50% of our students participating in person, our virtual parents feel supported and have their needs met with supporting their students, because our teachers ensure that the parents have the necessary tools they need to work with students. They're there to help coach parents. So our teachers have done a lot of reaching out to our stakeholders to ensure they still feel connected to the school and connected to the learning. And then I, as the principal, made sure that our staff and students felt valued, celebrated, and appreciated to make sure that they were still connected to the learning.
Dr. Anderson and Mr. Martin, if you can chime in.
With us, when we were not 5 days a week, we had call logs for the number of times that we contacted parents, and we were required to keep in contact with parents and students. Along with being hybrid, the communication with seeing those students face to face and talking with parents via on the phone or even virtually afforded us an opportunity. Especially when students had questions or needed help or needed support, keeping in constant contact with parents was very reassuring to parents and reassuring to students. And it was necessary in order for those students to be successful. Because I'm going to be completely honest, 5 days a week instruction for students, you do get to cover more content. However, some of the students articulated that they felt safer when we were on hybrid. So, but making sure to keep in constant contact with the parents, build positive relationships with the students and the parents helped in that aspect.
And this question is also directed to the panel. How do you address the social emotional needs of students who have lost family or friends to COVID-19, or students who have contracted the virus?
Many of the students who are going through those things, they work very closely with the guidance counselor. I've actually purchased students some journals to record their thoughts so that they could reflect, because some of the students, their parents have passed. Some of the students have had the virus as well, or had family members who had it and recovered. But I also have had students who have made light of the virus by saying, well, my mom said it was only like the flu, and misinforming other students about how deadly COVID can be. And they sort of blew it off. Those are really some of the students that you have to chase with masks, because my mom said it was like the flu, so it's no big deal. And then you have some students whose parents have passed away. So just trying to give them reassurance, support, encouragement, giving them a safe place to talk and to journal and to be a support, to check in with them and their parents has been beneficial, and working with our guidance department. I wish we had social workers like you do in North Carolina. I was just amazed.
In our district,
presentation.
In our district, I'm a licensed clinical social worker and licensed substance abuse counselor and school social worker. In our district in North Carolina, I don't know what your state is doing, but there's a big push to hire more mental health counselors into the school system. So it's myself and another mental health counselor, and we also have another grant where we have a trauma counselor. And so it's 3 of us. So you have the school counselors or guidance counselors, the trauma counselor, mental health, attendance coordinators, dropout prevention. But what we've have done about the lot of grief and loss is I myself and the other mental health and school counselors have been meeting with students using different evidence-based interventions and tools. We've been doing a lot of check-ins, phone calls, home visits, meetings, whether it's virtual or by phone, and different things of that nature. And we also have a contract with the outside mental health provider that's co-located and bills insurances and comes to our schools and does telehealth as well. And we also use and refer community mental health and other resources.
Similar to what Jessica described in North Carolina is what we do in Maryland. Our guidance counselors know our students by name since we're such a small school. So they did during this time virtual groups for students to share how they were feeling. They did one-on-one sessions with students. We have been very blessed this year that we did not experience any loss due to COVID, but we had several students who contracted COVID. And so we reached out to them with phone calls and support and cards and things like that to make sure that they were okay and check in. Also, our nursing staff did an amazing job reaching out to families during this time and making sure they had the health support they needed and tips and tools and resources to make sure that they were all safe during this time.
And I wanted to add this, the school resource officer that I mentioned that passed on a district level, our district central office superintendent, during one of the basketball games, they named the mascot after the lost school resource officer and had the family come and participate in that program. So I just want to point that out too. So it's a whole district-wide approach to the grief and loss experience.
Thank you. How have you provided support for parents in assisting them with remote learning, managing devices, logging and utilizing technology, whether you use Microsoft Teams, Google Canvas, and do you have lessons and tips on your Facebook page, YouTube, or other social media platforms?
So we as a district, since we're a very large district, we have a technology support team. Parents can reach out to them directly for support with the devices. Also, we kept at least one administrative professional in our building during this time. So students, if they had needs, they could come directly to the school to receive support with their devices. We also have a school Facebook page that provided tips and tools for parents to utilize to help their students with the technology.
Dr. Anderson? Our next question, how has learning been individualized and how do you support teachers who are not experienced with virtual learning? Dr. Setzer?
So when we entered into virtual learning, we did a lot of virtual PD for teachers. As a district, we decided to push out 2 lessons in the virtual environment. So that lessened the workload for teachers and also provided them an opportunity to learn and kind of become experts at the tools along with the students. So it has been a learning curve that has been steep, especially for my teachers, since most of my teachers are technical teachers in trades. And so that their computer skills were very minimal. So a lot of teachers reached out to their department chairs and to our technology liaison for support in those areas to beef up their skills to be able to support our students. So that has worked very well. In fact, one of our culinarians stated that this year he was kind of adverse to using technology, but since we've been in COVID, he's actually grown his skills and feels more comfortable with implementing technology in the classroom. So moving forward, that will be another tool in his toolbox he has to support students.
Thank you, Dr. Setzer. Dr. Setzer, what challenges have you faced as a school in teaching reading to students using virtual learning?
The challenge has been for us is students do not turn on their cameras, nor do they want to participate verbally. So we can't see if a student is mastering or using reading strategies effectively. So that has been one of the downfalls being in COVID, is that we can't accurately assess reading skills because students won't participate to see if they're fluent in reading, nor do they turn their cameras on to participate. So that's been one of the struggles with teaching in this virtual environment.
And we have had the same issue in our district as well. So tell me, Dr. Setzer, how do you communicate with your parents? Have you had virtual town hall meetings, mail, email, text?
So we use a contact system, we use mail. I found this year I implemented a monthly virtual town hall for parents, and I found that the most effective means of communicating with parents. They felt more connected. They understood why the district was making the decisions they were making regarding instruction. So I think that virtual town hall that we did monthly had the greatest impact to our parents and then to our students.
Thank you, Dr. Setzer. And can you tell us, in your district, do your employees receive hazard pay? We do not receive hazard pay in South Carolina, and I'm
That's
sure
interesting.
not in North Carolina either.
Yeah. So at the onset of COVID in March of 2020, our custodial staff and our cafeteria staff were still working, and they did receive hazard pay until the budget ran out. So in the beginning they did, and then once the budget ran out, they moved towards that staggered schedule so that they did not get to take the benefits of that hazard pay they received in the beginning.
And how has the pandemic changed the constructs of parent involvement in your school?
So as most of you know, as seasoned educators, when students move towards high school, parent involvement decreases. So the parent involvement that we've seen has been similar into prior years. You know, the parents that are involved are actively involved, but unfortunately, most of our parents are not involved at the high school level.
And how has your district involved the opinions of their teachers, the community, the families? Have they distributed surveys, or how have they listened to the concerns of the educational community?
So in Maryland, in Baltimore County District, our parents are completely surveyed out. I'm just going to be honest, that's the feedback I receive. Our district probably sends approximately one survey a week. So parents are confused as what's important and what's not important. So part of us having the town hall meeting was kind of to let parents know that, yes, this one is important for you to complete. And this one, you can push that lower on the totem pole. But yeah, they have been inundated with quite a few surveys to complete. How is learning going? Are your kids, how are you doing? So they've been kind of, I don't want to answer another survey. Can you pick up the phone and call me? So that's what we've chosen to do as a school, since we are smaller in size.
And I think that's wonderful. I know one of the challenges in our district or in our state is that teachers have had problems managing student behavior with the virtual classes and having actual students within the classroom. Dr. Sessions, do teachers have assistants in their virtual classes to monitor behavior and to assist with learning activities?
So the only assistance that our teachers have in the classroom in the virtual environment is if we have students that need IEP or 504 support. So that one person can monitor the chat or monitor students coming in and out of the building. What our district did do was go to Google, since we are a large district, and ask for more safety measures so that students cannot enter a Google Meet session, which is the vehicle we use, unless they use their district issued email. Teachers can immediately, if a student is not participating positively, kick them out of that session, and then they would do a referral to an administrator, and we would enter into, come in and do some type of conference with the student and parent to get them back on track. So teachers felt very supported if students weren't doing the right thing from our administrative team to jump in and quickly correct those behaviors. But Google offered our district a lot of support in that area.
And if you had to give us, Dr. Setzer, your greatest lessons learned during this pandemic, Dr. Setzer, Mrs. Horn, Dr. Anderson, what would they be?
Oh, the greatest thing I can say is to, during this time, is to always extend grace to your teachers and to your students during this time. Our students have had to juggle siblings learning. We know the students had to work to support families during this time. So just making sure that we extend the necessary grace so that they don't feel overwhelmed and they still feel that if they're struggling, that they have an opportunity to meet with success. So I think that's the key piece during this pandemic is just to extend grace to our students. And for our teachers, they're learning new tools just as everybody's learning new tools. So extending them the grace and allowing them to take the risk that I haven't mastered this tool yet, but I'm trying. So just supporting them in that is what I feel is important as an administrator.
Thank you, Dr. Simpson. Are there any other comments?
I was going to say that valuable to learn from this experience, and we're continuing in this pandemic, to normalize and not just focus on the cons, but the pros. For instance, a lot of school districts are offering virtual academy and continuing virtual learning as a learning option instead of just going back to traditional in-person, physically in the building. And just trusting we are all trained professionals in our area, and just trusting your training, although you might have to have modified your teaching or counseling or other styles of practice. We just need to focus back on these things and take it and enhance it or modify it based on any given situation, and always to be prepared. We can't prepare for every little minute detail of a crisis, but having that crisis plan in place. And I think this really has allowed districts to have, like when you have a snowstorm or something, we would just be out of school and make up days. But now that we have been introduced to virtual learning, what other options can be put in place?
Thank you, Mrs. Cohen. Thank you, Dr. Simpson. At this time, do we
I,
have any? Oh,
I'm
yes, go
sorry.
ahead, Dr. Anderson. Thank you.
I was going to agree with the response. All of these are just right on point. I agree. And learning so much from how to use virtual learning effectively to affording grace and showing the need for mental health, socio-emotional learning, and the trauma that our students experience, how it impacts them on not just academically, but just overall. And this has put mental health to the forefront. And to me, we're in our state, it seems like we don't have those social workers in every school, but just the need for it and the need to provide students this extra level of support, and even the adults, this extra level of support would be very beneficial.
Thank you, Dr. Anderson. At this time, do we have any questions from our participants, our visitors? Or any comments?
I have a comment, Dr. Sawyer. This is Dr. Canty. How are you?
Thank you. Welcome.
Thank you. I just appreciate all the information that was shared by the panel. It was so enlightening to, hear what was going on in other states and other districts. This has all been a trying time for everyone, but it's good to see that our state, South Carolina, is not alone, and that there are, issues everywhere. And just once again, thank you for sharing.
Thank you, Dr. Candy. Are there any other questions or comments?
Yes, I am. My name is Pastor Terry Norfleet. I am a EC teacher in Halifax County Schools, middle school level. And I'm telling you, this has really enlightened me today. I'm so happy that Dr. Sawyer sent me the link. And when I seen it, I'm like, ooh, this sounds interesting. I'm coming. You know, and I'm glad that I did, because it helped me a lot. It gave me some insight. One thing that I heard that, and I'm glad that we do at our middle school level, we do have that recess session, but we call it freedom from your mask. You know, so that's what we do. We take them outside. Each teacher in every session take the kids outside and let them take their masks off for a minute, and then they come back into learning. And also we operate on the A and B day, but our A and B weeks, that's what we call them. One set of kids come for 1 week, Monday through Thursday. Friday is cleanup day. And then we have the next set of kids coming in for the following week, you know. And we started back in March too. We stayed out from March to March, a whole year. And I could say that I still feel, I don't know, I don't feel as secure. I just didn't think it was safe enough to bring them back. I kind of thought we should have went on and finished on out the year on the virtual, and then waited to August to bring everybody back safely, you know. But unfortunately, we know it didn't happen that way. So a lot of us had to come back. And I am in North Carolina. But I learned some things today that I'm going to take back to my class, to our my colleagues, and you know, everybody. I wish I could have got this link to my superintendent, so that assistant superintendent, so that she can hear it. She would have really been blessed by it. But I want you to make sure that you let us know again when you're going to do this again, when you're going to have this panel, where you're going to have it, because I'm going to definitely try to get Halifax County school system involved with this to hear what is being said, because I want to say that I thank you again. It helped a lot, and we do need it.
Thank you, Pastor Norfleet. And there will be a recording that I sent to everyone.
Okay, good.
Are there any other questions or comments? We thank our illustrious panel for volunteering their time and their expertise. I hope all of you have a wonderful weekend. Stay safe. And until next time, have a good afternoon, everyone.
Thank you for having us.
Thank you again.
Thank you. Great job.
Enjoy the rest of your weekend.
Enjoy your weekend.